Welcome, everyone. We're happy that you can join us today for the second session of the Campus COVID Q&A webinar series. My name is Sue Ng. I'm the Deputy Director in the Office of Administration and Finance, and I will be your moderator today. Please know that this is a safe space for you to ask questions about COVID vaccinations, boosters, masks, safety measures, and other COVID-related items in place at Hostos Community College. This session is being recorded. Closed captioning will be available. You may submit your questions in the Q&A box, or if you are attending by phone, you may raise your hand and I will call upon you to ask your question. Please note that the Q&A box is different from the chat box. Today, your panelists are Fabian Wander, Director of the Health and Wellness Center, and Zack Korenstein, Environmental Health and Safety Consultant, along with a special guest, Nurse Vasquez. I will start off by asking Fabian and Zack to explain their roles in the college, and then we will move to special guest Nurse Vasquez.
Thank you, Sue. Thanks for the introduction. Good afternoon, everyone. Beautiful day today. Hope everyone is able to go outside and get a little bit of that sunshine and warmth there. So my role, my name is Fabian Wander again. I am the Director of Health and Wellness Services here at Hostos Community College. And my role as it pertains to COVID is to basically review everyone's every student's COVID vaccine that's submitted to us. And these are students who are new to the college or students who have been currently been enrolled in the college for a couple semesters. My role is to manage everything related to the COVID compliance aspect of the campus operations. So I'll talk a little bit more about some of the policies that have been shared through CUNY Central, and as the ever evolving regulations and policies change, we try to inform and educate the community as such. So thank you, Sue, for the introduction, and I'll be happy to answer some of the questions as we move forward.
Zack?
Thank you, Sue. Thanks, Fabian. As Sue mentioned, my name is Zack Korenstein. I am the Environmental Health and Safety Consultant, Environmental Health and Safety Officer for Hostos Community College. As it relates to COVID, I've been very involved in absorbing guidelines from CUNY Central as well as from the state and the city, and seeing how we can apply them best to the college. Specifically, I've been touching masks, mask policy on campus, and other preventative measures, in addition to some infrastructure issues like improved ventilation, which Hostos has put quite a bit into in terms of getting to all CDC recommendations. So I work hand in hand with Fabian and the rest of the leadership so that we can help to guide us through this pandemic as best as possible, with the best information that we can. Of course, keeping in mind that, as Fabian said, things continue to evolve and change on a very regular basis. Of course, I'll talk about another update that just happened today, a little later on. So back to you, Sue, and hopefully.
Thank you, Zack. We'll start with some questions from last week, some of which came in after the first session. And Nurse Vasquez is certainly going to come on today. She is just experiencing a bit of technical difficulty right now. So we will have her join us as soon as she can. I'll start off with one of the first questions, in which a student asked if there is a way students can provide weekly test results or even every 3 days if they do not want to take the COVID vaccine.
Sure, thank you for that question, Sue. So the regulations are, if you are enrolled on campus, then you are required to provide proof of your COVID vaccine. The only exemptions for that is if you apply for a medical exception or a religious exception. And if those are approved on your end, then you would then be required to do weekly testing at any of the CUNY campuses. So those are the only exceptions for students who do not fit into those categories, we recommend that they look for a online option. You're muted, Sue.
Sorry, thank you. Thank you, Fabian. The second question is, a professor teaching in person noticed that students' masks misfunction by sliding below their noses. Can the college bring different size masks for professors to take and offer to students, or can you offer any other suggestions?
Okay, this is a good question and something that, we do certainly see from time to time. Some folks certainly have some issues in general with wearing masks. Unfortunately, it's still our current reality. So what I would say is that certainly in a classroom setting, you as the professor, you control that space. And as you would if two students were speaking in the back, you would kindly, respectfully ask that student to please pull the mask up and make sure your nose and mouth is within the mask. Now, again, it does slide often, but the majority of masks, surgical masks, KN95s, KF94s, N95s, they tend to have either a plastic or a metal strip in the nose. And so, oh, hello, Nurse Vasquez, how are you? Right in the middle of something, but I'm glad you're here. So again, this metal strip or plastic strip will be in the majority of masks. I find that many people tend not to wear masks appropriately, and in particular, not pinch that little strip. When you pinch the strip on your nose, that's going to hold the mask more onto your face. So that's a really important point and something that you should kind of share with folks, that you can kind of see if the strip is not depressed in any way, they should pinch that down as much as possible. In terms of the aspect of the question of different size masks, yes, there are different size masks, but mostly for clinical situations. If you notice that a lot of the language we use is non-surgical N95 and non-surgical KN95. Most of these are deemed regular size. That doesn't work for everyone all the time, unfortunately. And unfortunately, we really do want to get the typical size mask that will fit most people. If folks are having real big problems, if your face is extremely petite or rather large, by all means, please do reach out to me. And I'd want to do our best to see if we have other types of masks that are available. But again, most of the time, it's going to be a regular size mask. It's not going to be perfect. But again, pinching the metal or plastic strip on the nose is really important. And so certainly, please do remind folks of that when it is slipping off the nose. And we want to keep the nose and mouth both inside the mask at all times still.
Thank you, Zach. One other question from last week was, how often are the air filters in the HVAC system replaced? And I can answer that, or Zach can answer that, since he is also aware.
Sure, it's a simple answer. So this is done quarterly. So every 3 months, all filters of all air handling units are replaced with new filters, keeping our air as fresh and clean as possible. Like I said, I just want to extrapolate a little bit more. When I say that we've met all CDC recommendations, that's something that very few campuses have been able to accomplish. There is another video further back in time before this series where I go into great detail. By all means, I can speak again about ventilation, but let me just simply say that all of the recommendations that the CDC put out in terms of HVAC, heating, ventilation, air conditioning improvements, Hostos has done at great expense. So again, in terms of the specifics of the filters, they are changed out on a quarterly basis, roughly every 3 months.
Thank you, Zach. Just as, I guess, a follow-up, Professor Bernardini has posted a question in the Q&A box. Can you read that? I mean, I will read it aloud for the audience if yeah. So Professor Bernardini asks, the college has expressed great confidence in Hostos's ventilation systems. Given this, can you explain why the college has not shared any room-specific ventilation data with the college community?
It's a great question, Professor Bernardini. Thank you so much for it. So as I was saying previously, so let me extrapolate a little bit more because Professor Bernardini has been aware of a lot of these conversations. So again, when I say the CDC recommendations have been met, let's take one step back, right? The CDC makes recommendations. They actually do not give regulations or laws. So I think it's important to remember that ultimately when they send out this recommendation, there is no specific obligation for us, Hostos, to comply with all of them. However, Hostos has. We have actually done quite a bit in terms of filtration, increasing the level of filters that are being used. We've put in line UVC, ultraviolet light disinfection. This is a level of disinfection and air quality control that is common in hospitals. And that's what we have here at Hostos. In terms of the overall volume and movement of air in and out, we are very confident that the buildings as a whole are exemplary, meeting and exceeding all current standards and meeting and exceeding the current recommendations. Why haven't we provided this data per room? Well, it's quite simple. It's not necessary. Not only is it not necessary, but I think that the question itself kind of shows that there's a slight misunderstanding of what that ask actually is. It requires sophisticated equipment that we do not have in-house. We would have to go to a third-party outside consultant. It would be an extremely costly and time-consuming effort to determine each and every room's data. So that data has not been collected, and there's actually no need to collect it. So that is why we have not shared that data. Again, the overall building systems are being maintained and overseen on a daily basis. Anecdotally, many members of the Hostos community have shared with me that they notice they feel more air. There's, depending on where you might be on the campus, you might actually feel the air coming from a vent. If you don't feel anything, that doesn't mean there's no air, by the way. There is constantly air being provided into our spaces. At a bare minimum, all the air changes over every 15 minutes. So all the air we breathe out is exhausted out, and fresh, filtered, and disinfected air from the UVC is brought into the building for us to be comfortable. Certainly at the height of winter and the height of summer, we do have to make adjustments for overall comfort. But again, we have close to 100% outside air that is filtered, disinfected before it comes into our buildings. And then again, at least every 15 minutes, all of that air is exhausted out of the building. I am very confident in saying that there are few buildings, certainly not my apartment building, that has ventilation as sophisticated as this.
Thank you, Zach. There is a second question from the participants, and I think Nurse Vasquez may be able to answer this one. The attendee asks, how many days are allowed off if you have COVID?
Okay, yeah. Good afternoon. I am Nurse Vasquez. Every case is, differently because it is 5 days according with the new guidelines of the CDC that we are aligned with the New York Department of Health, New York City Department of Health, and also CUNY. It is only 5 days of quarantine or isolation, but it depends on each case. Okay, depends on the symptoms, depends how the person is recovered. Okay, we can extend it until 10 days.
Thank you, Nurse Vasquez.
You're welcome.
The next question, I think we'll have to go back to Zack. And an attendee asks, as a follow-up to Professor Bernardini's question, you say that the buildings are exemplary, so that makes it sound like you have the data, but then you say that there is no need to collect the data and that it would be expensive. So which is it? Could you just share it if you have it? Not sharing it sounds like there's something to hide. This contributes to it feeling that there is something to hide. This is why people feel like there isn't transparency.
Good question, indeed. So the data we do have is building wide. We do not have specific data per room. That does not exist. And like I said, it's quite time consuming and expensive to obtain. So the building wide data is what I'm referring to when I talk about the overall air exchange rates of every 15 minutes. In addition, this is not just me saying this. We did have a third-party entity, Ramble, involved in assessing the ventilation. This was a CUNY central effort. And so Ramble and their consultants were on site investigating our facilities, investigating our buildings and all of our data to re-verify that what I am saying is accurate and transparent. Those reports from Ramble have been made available to the PSC. Certainly, Professor Bernardini is well aware of that information. In addition, anecdotally, I will tell you that during the actual walkthrough with the consultant, he did refer to our equipment as, wow, amazing. This is verbatim mentions that he made based on the fact that we were able to put ultraviolet irradiation in all of our air handling units. So again, this has been verified by Ramble, a third-party consultant through CUNY Central, and that information is available essentially to all.
Thank you, Zack. We have another question. This one will probably be best answered by Nurse Vasquez or Fabian. The attendee asks, must you get tested at a CUNY site? Can you bring in results from a non-CUNY site?
Yes, you must be tested at a CUNY site. You cannot bring in test results from a non-CUNY site. And the reason for that is all CUNY sites are connected to the Clear 4 Pass and your Hostos ID. So what happens is, let's say you get tested, you're required to get tested because there are also random tests that are being assigned for vaccinated folks as well. And if you get tested today and you may not check your results and you test positive, you will not be allowed on campus. You'll try to swipe your ID and you'll be stopped at public safety. That's a way of preventing, keeping us safe. Our nurse will also be alerted if there are any positive cases, so she can also do the follow-up with the team. So this is why it's really important that all the testing be done, and it's only permissible through the CUNY campuses testing sites.
Thank you, Fabian. We have another question. What are the exact vaccination rates, exemption rates? When were these rates measured?
So as far as, I can't speak on the vaccination rates of faculty and staff. I can just tell you that with respect, I don't have the exact numbers in front of me. I can tell you that with respect to students that were approved, we have over 5,200, and probably it just continues to rise of students that have been approved for vaccines. There is a really small amount, and I can tell you, maybe a handful of probably religious and medical exemptions that have been approved on the campus. And if they're religious exemptions, they'll go on. And if they are approved, then those students are required to be tested weekly. If they're medical exemptions, it's generally temporary. For example, a physician might say, well, they tested positive. We don't want them to get the shot until this date. And so it's a temporary exemption. And then they're required to get tested or to get the vaccine after that. Not many students in that situation. And so, and of course, all the students that are on those exemptions are required to be tested weekly to be able to come onto campus.
Thank you, Fabian. Another person asks, when will the cafeteria and the garden between the B and C buildings open up? Seems like it would be safer for students to eat in those bigger spaces rather than in the hallways. Well, I can just let everyone know that we are currently looking to find a vendor to provide grab and go service, grab and go food in the cafeteria. The contract has not been finalized yet, but once we have someone in, we will let the community know.
I think I would also say, and Sue, I think you're aware of this, that the cafeteria is open for students to use for lunch. You know, I'm not sure if the door is locked or not, but you know, my understanding is that the cafeteria can be used for folks during lunch. And then one other thing I would say is, I'm not sure it's necessarily more dangerous for students to eat in the hallways versus the cafeteria. I think it'd be more comfortable for students to eat in the cafeteria. And certainly there's a larger overall volume of space in the room. So I could see why you might think it's safer, but I'm not sure if it's safer or not to necessarily be in the hallways. So.
Thank you, Zach. Another question comes from a participant. Yesterday, we were told about faculty and staff vaccination rates being above 90% at Hostos. Where did this data come from? And can we see it?
So if I could jump in, actually, I know this must be an English faculty member because I was in the English faculty member team. I don't know who asked this question, but you must be one of them. I'm mistaken. I apologize for that. I think I got a little confused in terms of that vaccination rate. I do not have it in front of me. That data is really held by Fabian and by HR. And so it's not what I said it to be. It's close to that. But again, I think it's best right now that those numbers are private and HIPAA protected because it's students and faculty. But again, it's close to that, but I was wrong when I said that. I do apologize for that. So we're getting there, but not quite at what I mistakenly thought it was.
Thank you, Zach. Another question from the participants who asked, please help me understand the benefit of having vaccinated people tested randomly. What about those who are not tested who could possibly have COVID? Isn't this like a hit or miss or the luck of the draw?
Nurse Vasquez, you want to respond? Do you want me to respond? So basically, the purpose of testing folks randomly, whether they're vaccinated or not, is because the facts are you can be vaccinated, and I was vaccinated, and I got COVID, and I can spread COVID. So I think it's just an additional layer of safety that CUNY had rolled out, and this was done in planning stages months back to kind of roll out this next step of safety. It's an additional measure of safety where if you're vaccinated or you get these random emails that you have to be tested. I believe it's went up to about 20% of faculty and staff that are on campus. And it just provides another layer of safety. I was selected, I believe, a couple weeks ago. I went into the art gallery. I did the test myself. It was really comfortable, super easy and fast. And I submitted. And in fact, I felt kind of good about that because I generally get tested unless, it's a situation like this that I have to be tested. So I actually was happy that I was able to access the testing site that easily, where you see people, waiting hours outside online, this is a real great benefit that the college offers. And again, it's just to provide an additional level of safety measure. Nurse Vasquez, I don't know if you want to add to that.
No. That's correct what you just mentioned right now, because the random testing is, just selected, students, faculty, and staff by CUNY, just to do an extra, measuring of safety to our students, faculty, and staff who are here in the campus. And, like we are in other places, we are all overexposed. And it is very important on these days, to be testing.
Thank you, Fabian and Nurse Vasquez. I'd like to follow up with another question from an attendee. Will there be more streamlined communication with health and wellness and registrar and the advisement units on campus in regards to students being dropped for non-compliance with the COVID vaccine? Students were dropped from courses and the lists were not shared with coaches and advisors in a timely manner.
Yes, so well, let me just start off with students were communicated multiple times about the COVID vaccine mandate. And in fact, SDM took, a little bit of more of a proactive approach and reached out to each student that was not COVID compliant individually via email. And in fact, they followed up with phone calls to each student, letting them know that if they do not comply with this COVID mandate by a certain date, their classes are going to be deregistered. Once they submit their vaccine, then they can re-register as long as before February 3rd. So they really did a lot of effort into reaching out to those students. We can't, violate students' privacy and let the advisors know that these students, for example, are unvaccinated or are not submitted. We could say they're not in compliance. That's something we can definitely work on improving with respect to those communications. But I can tell you that every single student that was not in compliance with their vaccination status were warned that if they do not upload by a certain date, that those classes will be dropped. And in fact, that was great because a lot of students kind of were submitting vaccines up to the the last minute, and we were clearing them as quick as possible and advising them to re-register. So we were doing everything we could, but those communications were really helpful.
Thank you, Fabian. The next question, I believe Zach may have some maybe more knowledgeable about. The attendee asks, so filters are changed quarterly, but how often are they inspected? How do you know when they need to be changed?
Sure. So I'll give that a try if I could. So how do you know when they need to be changed? So that's based upon the manufacturers of the filters themselves and the overall HVAC system that is managed by facilities. So there's a number of factors involved in making that determination of when they need to be changed. There's also maintenance logs and protocols that go into when they are changed. How often are they inspected? I don't know exactly how often they are inspected. I think I'd have to probably get back to you all on that. Like I said, there are facilities personnel that are involved in maintaining the HVAC system on a daily basis. Are they inspecting each filter daily? I'm not sure. Absolutely, the system is really maintained pretty much 24/7 actually. But again, how often are they physically inspected? We'll get back to you with that answer.
Thank you, Zach. Another attendee asks about booster shots. When will booster shots be mandated for eligible students, faculty, and staff to enter campus? Do you know the percentage of eligible students who have received the booster?
So I can only speak on students' mandates, not faculty and staff mandates. There's already a mandate out there that students that are enrolled on campus classes are required to get a booster shot. So it really depends on when you received your second shot, if you have 2 shots. So for example, if I received my shot today, my Moderna second shot, I have to wait 5 months to get that booster shot. So let's say 5 months passes. I then have to get my booster shot. I have 30 days to put that booster shot into CUNY first to show that I'm compliant with that booster mandate. If I have the Johnson & Johnson vaccine and I receive it today, then 2 months later, I am eligible for that booster vaccine. And I have 30 days to upload that vaccine onto CUNY first. With respect to faculty and staff, I don't have those details.
Thank you, Fabian. As a follow-up to the vaccination and random testing question before, somebody asked, what if somebody gets in who has COVID and was not tested randomly? And I hope I'm asking that question correctly. I'm
gonna, that's a good question, because I think, whether, I fully understand the question. I think it's important for people to know what to do if they test positive for COVID, if, faculty, is communicated with, which I've been seeing this week, not a lot, but there's some faculty that are reaching out saying, oh, the student said they were exposed. So the protocols for that is to reach out to Nurse Vasquez immediately. The student should be reaching out to Nurse Vasquez, or the faculty as well, letting them know, student informed them that they, may be positive but I'm going to allow Nurse Vasquez to talk about what happens when she's notified that someone tests positive.
Yes, the protocol is if any student, faculty, or staff develops any COVID symptoms or testing positive, immediately they need to send me a notification for me to do the follow-up, and also give you the days of the quarantine or the isolation, and also give you the date of the clearance. That's basically all the protocol that we follow here, aligned with the CDC, with the New York City Department of Health, and also to CUNY.
And in addition, the ID cards are deactivated. So they will not be able to come back onto campus until they're cleared with Nurse Vasquez's office to be sure that they're not, that they're not symptomatic.
That's correct. When if any student, faculty, or staff do the COVID test using any CUNY testing site, and then I receive an alarm from CUNY saying that, that a student or faculty or staff is restricted to enter to the campus, and then I get and communicate with the student, faculty, or staff, and give you the instructions what to do, and give you the days of the isolation or quarantine, and also when is the date of the clearance, and when they're supposed to do the test in order to come back to the campus.
Thank you, Nurse Vasquez. There is a related question. Somebody asked, why is my ID card not working if I am fully vaccinated?
Yes, I can answer that question. Okay. Sometimes it takes time for CUNY force to transfer the vaccines to CLARE4. That's one of the reasons the students try to enter to the campus and the ID is not working. Suppose the students upload today the vaccination card and was approved today. They need to wait at least 24 to 48 hours for the system to transfer the information from CUNY force to CLARE4. The other issue can be if the student is a transfer student, and then can be an affiliation issue because the student was registered in another campus. And then I have to send a ticket to CUNY, and then CUNY is the one who would transfer the student information to our system for the system to receive the pass in CLARE4.
Thank you. There is another question, kind of related to that. The attendee asks, I have a medical religious exemption. Can I enter the college without being tested at a CUNY test site?
Okay, I
No.
can answer, no.
You're going to be not allowed on campus, no.
No. Okay, because the reason is the students receive the religious exemption. They need to do the COVID test first and then waiting for the result. They want to receive a message from Clear Force saying that they are clear to enter to the campus. They want to receive a 7 days pass. And the students need to do the test 2 days before the pass expires to continue have access to enter to the campus.
Thank you. The next question asks, the attendee asks, what are the consequences if you do not wear a mask on campus? Who should you call or notify if you see someone on campus not wearing a mask in areas where they should be wearing them?
Yeah, so Zach, did you want to say something?
Fabian, by all means, we could both chime in, but go ahead.
Yeah, so I think, and I learned from Zach as well. If you feel comfortable, you can say to the student, would you mind lifting your mask? Because sometimes people have them down, but you don't have to do that. We have safety ambassadors on campus. These are students that have been hired working along with public safety to kind of be able to speak to students about, keeping their masks on. And the other thing is you can reach out to any public safety officer and they will speak with the student in a kind way just to remind them to keep masks on. But I'll pass it to Zach. I think he might speak about eating and drinking.
Right. So, yeah, I mean, Fabian, that was right on the money. I think that, we want to be respectful. We don't want to get into fights with anyone over masks. It's really not worth it. Again, you can ask them to put their mask on. When I walk through campus, if I see folks not wearing a mask, sometimes I just do this motion, pull the mask up. Sometimes I might use no words and folks will put their mask up. But again, I don't want anyone getting into a tense situation with a student or others. If there's someone who is repeatedly not wearing a mask in the same location, especially in your class, you should get public safety involved. If there's a staff member or faculty member who is not wearing a mask and continues to not want to wear a mask, I would ask you that you speak to your chair, and then the chair should certainly involve me and HR if someone continues to refuse a fairly simple ask of wearing a mask out of respect for others, and of course to protect yourself as well. And I think I was going to say a little more about masks, but we got a lot of questions, so let's go back to the questions.
Thank you, Zach. The next question is, as I understand it right now, the policy is to email or call Nurse Vasquez anytime faculty, students, or staff test positive for COVID or have any questions related to COVID, such as exposures and quarantining. Do you all feel this is an efficient policy, and are there any plans in the future for a more streamlined mechanism for reporting?
Yeah, I think you can also reach out to HR if you're a faculty and staff and you test positive. You can reach out to Christine Diaz-Singh or Denise Gomez and let them know that you've tested positive for COVID. At the moment, this is the policy and this is the what we have in place. We're always welcome to take feedback, and if anyone has other suggestions, we will be happy to include that. We are in the process of bringing on two COVID response specialists, and they're going to be just kind of helping out the team with any of those follow-ups and phone calls. But at the moment, Nurse Vasquez or Christine Diaz-Singh are the folks that should be notified, specifically if they're faculty and staff. If they're students, definitely notify Nurse Vasquez's office immediately. But please email me if you'd like to meet and to talk about other suggestions and ideas. We'll be happy to have that conversation and welcome any ideas that could be helpful in keeping us safe.
Thank you, Fabian. The next question is about boosters. The attendee asks, according to the language posted on the cuny.edu site, all students taking in-person or hybrid classes and eligible for the booster on January 28th must upload proof of receiving a booster to CUNY First by March 1. Students who miss the deadline to upload proof of the booster will not be able to register for the summer or fall 2022 semesters until they do. Their question is it safe to assume that students who are eligible for the boosters and do not upload their proof by March 1 will not be dropped from their current spring classes, but it will impact their enrollment for summer and or fall?
Yes, that was a good assumption. It is accurate. If they do not upload their vaccine, they will not be allowed to register for the summer or the fall, but they will not be dropped from classes this semester.
Okay. And actually, as a follow-up to the previous question about the team that people should contact, it sounds like an enormous burden of work is being placed on one person, Nurse Vasquez, to handle complex COVID issues on a case-by-case basis with thousands of students, faculty, and staff. Why has a team of other healthcare workers not been assembled to assist her?
Yeah, so we are in the process of assembling that team. We do have support staff that work with Nurse Vasquez, and has included the Human Resources Office, works alongside and supporting Nurse Vasquez. And we recently onboarded we're in the process of onboarding two other COVID specialists that are going to be doing the follow through. Remember, we weren't on campus prior really as much as we are right now. So this is why we're really increasing the support staff for this response. Prior to this semester, many of our students were online, and we had some on campus. So now that we're on campus, we've been in the planning processes and onboarding processes to bring in more folks to help the office support any of these cases that come up.
Thank you, Fabian. I think that may also answer this other question in which the attendee asks, is there another way to get in touch with Nurse Vasquez? Can they go in person?
Sure. We are here open Monday through Friday, 9 to 5. And also we offer schedules appointments to the students of their, when they're available for convenience for them to don't conflict with their schedule. And we are here to offer the services in person too.
Thank you, Nurse. Thank you, Nurse Vasquez. There's another follow-up question. How do I know if I've been exposed on campus? Who will tell me, and how will I be notified?
Okay. If someone here in the campus are being exposed to COVID, and then I receive the notification immediately, the ones who are considered close contact is the ones who want to receive a notification, is the one who want to be restricted to enter to the campus, is the one who will be in quarantine if they are considered close contact. Close contact is considered within 6 feet or less than 6 feet, 10 minutes or more. It's not, for everybody who was in the same place. We take out only the ones who we consider at high risk, the ones who are in close contact with the person who tested positive to COVID within 6 feet, 10 minutes or more.
Thank you, Nurse Vasquez. There is a question from Elizabeth Wilson, who asks, Fabian, I believe you mentioned that students can see if they're cleared for campus access based on their upload of COVID vaccination and booster, if applicable. Please provide, she asks if you could provide a screenshot or link to instructions for students to check.
Yeah, so I don't have the ability right now to screenshot, but the way they can check their status if they've been approved for their COVID vaccine is really simple. It's the same way they went in to upload their vaccine. So when they went in to upload their vaccine, they went on CUNY first and they opened up the tab that says vaccination verification. Once they open up that tab, it'll show that they submitted their vaccines, and it'll show that it was approved or not approved, or it would just say submitted and it has not been reviewed. I can tell you that we review vaccine uploads multiple times during the day. So, if they submitted by the end of the day, they definitely have been reviewed and there's a response there. Now, if they were, let's say, approved, then they would get an email that evening or I believe late in the evening or the next morning saying that there was a change in their vaccination status. And then they can see that it was approved or not approved or submitted. Now, as Nurse Vasquez mentioned, there's a lapse. So let's say I approve you on CUNY first. There's a couple, like I think a 24-hour lapse where, or 2-day lapse. Is it 24-hour, Nurse Vasquez?
Yeah, 24.
24 hours where I approve you on CUNY first, and then by the time you get your clear pass to get on campus, there's a little bit of a lapse. So what I've told students, and we've spoken to public safety about this, if there is that lapse, just show the public safety officer that you've been approved for your COVID vaccine. And you can simply do that, as I mentioned earlier, just opening up CUNY first, vaccination verification. Once they click on the link, they'll be able to see that they've been approved, and public safety can help them through that process, or one of our student ambassadors can help as well.
Thank you, Fabian. I do notice that we have an attendee who applauds Nurse Vasquez for all the hard work she's been doing. Thank you very much. We agree. Let's see.
Okay.
Okay, we have a question. Students were mandated to get vaccinated. When and why have employees like faculty and staff not been mandated by CUNY to get vaccinated? Is the question.
So right now, we're waiting for some guidance and information from CUNY Central. There was a Board of Trustees meeting. I don't remember the exact date, where they did approve some mandatory vaccines for faculty and staff. I can't tell you the exact date, but I believe it was in the beginning of February. And I think they're in talks with PSC to figure out the language that's going to be shared and the processes with respect to mandating faculty and staff. So it is in the works. They're having conversations, but we've not been sent anything yet as far as how the procedures will work on our end. But it's definitely, it's coming.
Just to follow up on that question and Fabian's answer, faculty are required to be vaccinated to be on campus. Staff has not been mandated yet. Okay, another question. Can I bring my children with me to work if they're vaccinated? Must children coming on campus be vaccinated?
I didn't know people would commonly bring their children to work. I'm not sure about that, but yeah, the only children I think that are coming in might be going to the dental center. And at this moment, there is no requirement for the vaccination for children under the age of 12, I believe. Fabian, please correct me if I'm off on that.
Yes, but yeah, actually the Children's Center will be opening, I believe, in about a week or so. So they're officially reopening, which is excellent. It's a good question. I actually thought that same question myself. And my kids sometimes come to the college to visit, and they really love to kind of walk around. I don't know what the regs are on that. I know that at one point they were not allowing the children to come on campus. I don't know how that has changed. We can look into it. I don't know what the CUNY policy is on that. Nurse Vasquez, are you aware of anything?
Yes, no, the children are not, allowed to come in to the campus. Just if the parents just come, to do, a payment, probably, to Borsa or something, if they are fully vaccinated, but it is a children's under the 12 years old. The policy is still not changed yet, okay, about bringing the children here to the campus. Okay, it's something that we have, to check back again with CUNY if they change it, the policy they have a previous, because every time it's adjustment of the policy and we have to review it again.
So we will follow up with the
Yeah.
with the question.
Yeah.
So please stay tuned. Somebody asked, if I travel outside of the United States, am I restricted from coming back to class for 10 days?
No, it's not restrictions. But if somebody, travel, outside to United States and tries to come back, I get in contact, with the student, faculty, and staff to advise what to do. But if they are fully vaccinated, it is only recommendation 3 to 5 days to do the COVID test. If they are not fully vaccinated, and then we apply, the CDC rules that they said stay, 5 days in quarantine, and then in the day 5th, you have to do the COVID test.
Thank you, Nurse Vasquez. Another question asks, another attendee asks, the New York governor announced that they're relaxing mask mandates in the state. Is there any chance that we'll relax mask wearing on campus this semester?
I'm so glad someone brought this up. This is new news as of today that Governor Hochul has actually allowed the mask mandate to lapse, actually, because it will end tomorrow. I do not know if we're going to relax our mask mandate this semester. Again, I would be waiting from additional guidance from CUNY Central on that. Let's not jump ahead to suggest that we will not be wearing masks. We will continue our mask mandate for the immediate future. Please continue to wear the masks. We're all exhausted from this. We're all tired from this. I wear a mask all the time. I don't want to forever, but let me just say this real quickly. Wearing a mask is not a burden. Wearing a mask doesn't take your rights away. This idea that somehow it's un-American or takes away your rights, I don't quite understand that. It's a very simple control measure to protect yourself better from a respiratory disease. So I am not going to remove my mask quite yet, even though this mask mandate is dropping. I'm just going to speak to you about my personal feeling. When I go to the drugstore, when I go to the grocery store, I'm going to still wear a mask for now. Here at Hostos, we still have a mask mandate. I don't believe we would relax this till maybe next semester. Again, until I hear from the higher ups at CUNY Central. But, we're a large public institution. We move kind of slow. So I'd keep your mask handy for a little while longer. Okay. And again, if I were you, I wouldn't drop the mask immediately when some even health entity tells you to. It's not a terrible idea to keep it around for a little bit. Don't forget, this is New York City, the densest city in the United States. Okay. I imagine at least some of us, probably not me, will wear masks during the future flu/COVID season that we might experience. Because again, it's not really going away. But if it's up to me, we are keeping this mask mandate throughout the semester. Again, unless CUNY Central directs me otherwise.
Thank you, Zach. One last question. Somebody asks, where on campus can I safely remove my mask to eat?
Great question. It's a bit loaded, isn't it, right? I wouldn't say safely, but I would say relatively safely. You can remove your masks to eat in the cafeteria. If you go to the cafeteria and the door is locked, shame on me. We're going to try to work on that to make sure that students can access that. If you are a staff or faculty member and you have an office, I would suggest eating in your office for a slightly higher level of safety. And something I think I said last week, which is just because you walk by an individual that is eating and not wearing a mask, that does not mean that you are at a high risk of transmission. If you're wearing a mask and they're not, you're probably okay. You walk past someone with a nose out, you're probably going to be okay too, right? We want everyone to abide by our policies, keep the noses in the masks, but we can't eat with our masks, right? We have to allow people to eat and drink and do what they need to do. Again, your office is a great place. The cafeteria is another good place if that's what you need to do. But again, do not fear, do not fret those that are eating in your general vicinity. If you're a little more cautious, more nervous, walk a little faster by them. And I assume you'll be wearing a nice tight fitting mask anyways. You'd be well protected for it.
Thank you, Zach. Since we have now just reached 1 minute past 3 o'clock, I'd like to respect everyone's time and take this opportunity to thank Fabian, Zach, and Nurse Vasquez for the valuable information they have shared today. Thank you to all the attendees for coming. Should you have further questions that we were not able to get to today, please feel free to send them to the covid19@hostos.cuny.edu address, and we can send you a response, or you can come to the next session. A notification will be sent out to the community shortly announcing the next one, which will be on Wednesday, February 16th at 2 p.m. And I'd like to end this session by just repeating an attendee's comment that we want to thank Nurse Vasquez, the public safety officers, and all of those that have been keeping us safe for the past 2 years and so far this semester. And I totally wholeheartedly agree, and just let you all know that they're working so hard and their efforts are so appreciated. Thank you.
You're welcome.